So I'm going to go ahead and I'm going to palpate your liver now. You let me know if it's uncomfortable, all right?
Okay.
So I'm going to put my hand underneath you, but let me lift you up. Now take a deep breath. Now let it out. Very good. Okay. I could not feel it, and that's normal. Now I'm going to palpate your spleen as well. All right. Ready? Take a deep breath. Let it out. Good. Okay, now we're going to do check your kidneys. And that's going to be a deep palpate. You make sure and let me know if it hurts.
Okay.
Okay. Take a deep breath. Let it out. Good. And this kidney. Good. Good. Okay. So I couldn't feel those, and that's all normal. It would be concerning if you could. All right. So I think while I have you laying down, I'm going to move to the musculoskeletal, and let's do your hips while you're on the bed.
Okay.
And then I'll do the rest of the musculoskeletal on the edge of the bed or standing up.
All right.
So we're going to go out of order right now,
Okay.
okay? So your shoulders, elbows, hands, wrists, fingers, hips, knees, ankles, feet, and toes look normal. They look asymmetrical. It doesn't look like you have any problems. Your clavicles are the same height, and so that's very good. Your sternum is midline, and then I'm going to go ahead and palpate your joints. Hmm. 126 bones in your foot. All right, so I don't feel any problems with your body and your bones and your joints, okay? So I want you to go ahead and I want you to lift your legs straight up. That is flexion. When you put it back down, that's extension. We'll do the hyperextension later. Now try to lift your hand up against your leg up against my hand. Perfect. Now try to put it down against my hand. That's just perfect. Now if you could, go ahead and put your leg towards the center of your body. No, I'm sorry, not your knee, just your leg.
Oh.
Just a straight leg, and just move it over. Perfect. That's called adduction. Now put it out. Abduction, and you're adding to your torso when you're adding it in. Sorry. So that direction was adding, adduction. This direction was abduction. Okay? And then I want you to put your ankle on your knee, like sit like a man, like that. That's perfect. Now try against resistance. Now try to, good, lay it down against resistance. Now put your knee in towards your knee. Can you touch knees? Perfect. That's inversion. Lateral rotation, internal rotation. That's what that was. Okay, now I want you to point your toes towards your head. Good, and point your toes towards the TV. Now, if you could take your ankle and make it go all the way around. Perfect. And then raise your knee up and bend your knee. Perfect. Okay, now push against my hand again and push against my hand. All right, now try to straighten your knee. Good. All right. Now go ahead and straighten your leg. Perfect. I think we're going to go ahead and sit you up now. Go ahead and sit on that side. We did your neck range of motion earlier, so I think let's go ahead and do that again. Put your chin on your chest. Perfect. Put your head back up. That is extension. Flexion was chin on the chest. Hyperextension is back. Perfect. Ear to shoulder, and then can you turn right and left? Now let's do that against resistance. Good. Now ear to chest, ear to shoulder, ear to shoulder. Perfect. Very good. Very good strength. And then I'm going to check your lymph nodes at this time because I just remembered I didn't check those. So here's your occipital, your pre-auricular, post-auricular, submental, sublingual, submandibular, sublingual, submental. And I don't feel that those are enlarged at all or have any problems. And then I want you to go ahead and stand up now. And let's do your shoulders. Now, can you lift your arms out? And that is abduct. You're abducting, like you're abducting a child. Now put them in. You're adding to your torso, so that's abducting. And then put them up. And like you're swimming, and that is 160. That's pretty good. Now back. And that's about 50. Very good. So that was flexion, extension, hyperextension. And then go ahead and put your hands behind your head. That's external rotation. Now put them behind your back. That's internal rotation. And no pain with any of those movements. Very good. And then let's go ahead. Can you bend forward? I want to check your back. And touch your toes. Your spine is normal. Stand up. Good. And then if you could, I want you to bend your elbows. Put them back down. Up. Down. Good. Against resistance. Now I want you to put your hands and then make them go the other way. Supination and pronation. Perfect. Now if you can make your hands go inward, that's ulnar and radial. And then can you spread your fingers apart, make them into fist, and then spread your fingers apart again. Now try to close your fingers. Good. Now grab onto my fingers and squeeze. Perfect. And then go ahead and try to spread your fingers out. All right, good. And then let's put your hands up, put your hands down. And then put your hands back in a neutral position and try to put your fingers up. Can you bend? Now bend your fingers, just your fingers down. Perfect, okay. And then, good. Hips and knees we did, and ankles we did. All right, now I want to go ahead and check your torso. Can you turn to the right, turn to the left? All right, and then can you bend, and then bend backwards. That's hyperextension, right? And then good. Go ahead and sit down. We're going to do a neurological exam. I'm not going to test your emotions or your behaviors or your memory or your mental at this time. Okay, it's kind of like the eye test. We'll do those things later. All right?
Okay.
Okay, so what I'm going to do, if you could put your, you know what, stand back up.
Okay.
I'm sorry,
No.
I didn't do something. Put your arms out and touch your nose. Can you do that with your eyes closed? Good. Can you stand with your arms down, eyes closed, feet together, almost together? Okay, that's negative, Ronberg. You're very good. Go ahead and sit back down. All right, we're going to do a neurological exam. Can you stick out your tongue, wag it back and forth? Perfect. That's a hypoglossal cranial nerve. And Give me a moment. I went blank. I am, 1, 2, 3. I'm gonna count and think about the cranial nerves right now. 3, 4, 5, and 6, and 5, yes, and 6 was part of the 4, 7, 'Can you lift up your eyebrows? Close your eyes really tightly. All right, let me see if you can open your eyes against resistance. All right, can you puff open? Good. Smile with your teeth, without your teeth? Did we do this already?
I don't think so.
Okay. and then put your tongue in your cheek. Good. And then can you make like you're kissing? Good. All right. So that was facial gymnastics. That was very good. I think we might have done that already. Let's see. Oh. Okay, so I have a coin somewhere. No. I'm going to put something in your hand and I want you to tell me what it is.
Pen.
A pin. Good. Yeah, because I told you I had a coin. That doesn't work very well. Okay, so that's diagnosis. So I had to use a pin. You did very well. All right, now I'm going to write on your hand.
Okay.
Close your eyes, and you tell me what I write.
An 8. Circles.
It was a 3.
Oh, 3. Okay.
So that
a
was
W.
Graphy. Oh yeah, it was
There you go.
W. Yeah. So it was a half circle, and then that was graphius, like a graft.
Okay.
Okay. Stereognosis and graphiosis. And then I need to go ahead and check some sharp and dull. I want you to know that this looks sharp, but it isn't. See that?
Mm-hmm.
Okay, that doesn't hurt, right?
No, no.
And then that would be the difference between sharp and dull.
Okay.
So I'm going to test that on part of your body, and I want you to tell me where on your body and which one you feel, either the sharp or the dull.
Okay.
Okay?
That's on my right hand, and it was dull. Left bicep, and that was sharp. I guess right ankle, and that was sharp. Left foot, and that was dull.
Good. Very good. Okay. Now I'm going to test your bone to see if you feel the vibration.
Okay.
So go ahead and close your eye and then tell me where on your body, and then tell me when it stops.
Right foot, stop. Left elbow, stop.
Good. Good job. All right. Now I'm going to test your reflexes. I'm going to test your reflexes, okay?
Yeah.
So you need to relax, and I'm going to go ahead and test your tricep. All right, good. And then your bicep. Good. You got a little there. Now just relax.
Okay.
Look away. That sometimes helps. Good. Okay, now put your hands together and I want you to look towards the wall and try to pull your hands apart as much as you can, okay?
Okay.
Good. All right, now I'm gonna bend your leg up. Oh, that's not very comfortable, huh? Are you? Go ahead. Can you put your knees on the bed with
Yeah.
your feet hanging off? Thank you. Oh, perfect. All right. So those are all your reflexes. Now, accommodation, smiling, ears, nose, eyes, mouth, neck, shoulders, cardio, thoracic, joints, musculature. Okay, thank you very much.
Thank you.
All right,